So I was going to talk about an area of the economy where the internet hasn't had much of an impact, but might, and that's the healthcare sector of the economy. So one of the interesting things when you look at the healthcare sector of the economy is that, in comparison with other large sectors of the economy, financial services, retail, media and technology, it really hasn't had the sort of IT revolution or transformation that those other sectors have. And if you look at the numbers, for example, even today, more than half of physician offices use paper-based filing records. That is, they just have paper records. And if you go to an emergency room, they want to look up your record, they can't just go to the internet and look it up. They have to, well, they don't really do anything, basically. If you get admitted to the hospital, maybe they call over to your doctor, call around to different doctors, and the communication technology is fax. So it works, but it's not the internet. And during the healthcare debate last year, there's a very wonderful article in the Atlantic magazine, How the Healthcare System Killed My Father by David Goldhill. And he had a great line about the hospital that his father was in, where he said that his dry cleaner has invested more in tracking shirts than that hospital had in tracking their patients. Now, if you think about this, and then if you look at sort of academic studies or policy studies or white papers that are out there about the health sector, they're full of ideas about how information technology could transform healthcare. So things like, even simple things like automated scheduling, so you wouldn't wait in the doctor's office, distance visits like Chairman Janikowski was talking about this morning, home monitoring technologies, tracking patients, for across physicians. So you go to a hospital, they can just look up your record. Why can't they do that? It just seems like so obvious. In the age of Google, you can't find someone's patient record. Electronic prescribing. Why can't they just send your prescription over to the pharmacy and have it filled? Why can't it be waiting for you at the pharmacy? Just clinical decision support. Why can't a doctor type into their computer, if you've got a disease, get a summary of where you stand in the population, what are the possible treatments, how those work in people like you? Why don't we have that? It seems so obvious that we ought to have that in the age of technology. It's completely technologically feasible to have these things in a general sense. If you ask about things like population measures in healthcare, tracking of populations, measures of performance, all of these things would be easy to do if you had aggregated health data, but we don't. But we either have paper records, or in the case where we have electronic records, we basically have data in data silos in individual organizations. We have no aggregation of information. Okay, and there are examples of organizations like Kaiser that have used health records very effectively, but when you think about sort of the possibilities, the first thing you ask is, well, why hasn't this happened? And so it turns out there's when you start thinking about it, there's actually sort of several reasons, and they're basically the same reasons that you point to for all the problems in the healthcare sector. So one of them is the organizational structure in healthcare. As of today, or the most recent data from the National Ambulatory Care Survey, something like 30% of patient visits in the United States are to practices that are solo practices, so one physician, and something like another 30% are to practices that have two to four physicians. So that is, most patient visits in the United States are to practices that have 4 or fewer physicians. Okay, so why is that an issue? Well, so one reason is that the current technology for medical records, for using IT in healthcare, basically are big enterprise systems, or have been big enterprise systems. They're very expensive for small practices to install, and they can't internalize most of the benefits, which have to do with things like coordinating between generalists and specialists. If you're just on your own and there's no standards or there's no communication technology for moving records across, it's just not a very good economic deal as a small practice. Okay? And people do move across practices. The typical Medicare patient in a given year sees doctors in 7 organizations. Okay? The second reason is not organizational, but it's financial, which is that in the healthcare system, as you all know, payment is generally on a per-service basis. So the returns that people cite to doing things like information technology are often things like trying to reduce tests or reduce office visits. That's just not a financially sensible thing to do. So I was talking earlier this year to the CIO at Harvard Medical School, also the CIO at Beth Israel Deaconess. He sent me an email and he said, here's how the economics look for a hospital trying to adopt an electronic medical record. It'll cost millions up front. When you transition to it, you lose, for several months, you have about a 25% decrease in productivity. And then you can reduce your revenue by 15%. So it just doesn't look good at any stage of the equation to do this. Okay? And it turns out actually that sort of capturing the benefits is, in some sense, actually turns out to be a very subtle problem, because even in places that have adopted electronic medical records, take like Palo Alto Clinic, which is right across the street here, they have an electronic medical record, and they have the same one that Kaiser does. Turns out that Kaiser, one of the biggest benefits they've had economically from their electronic medical record is they reduced patient visits. They substituted remote visits or secure messaging. Okay, so that works at Kaiser because the Kaiser is paid on a capitated basis, not per visit, and the physicians are salaried, so they're paid on a capitated basis, not per visit. Palo Alto Clinic is also paid on a capitated basis for 50% of their patients. But the physicians, like my wife's actually an internist physician, hate doing remote messaging because they're paid on a per visit basis, on productivity units. So even if you have the sort of, at the organizational level, getting the incentives at every stage of the equation is extremely difficult.